Hey everyone, and a huge welcome to all the students tuning in today. Whether you're actively studying biology or you're just super curious about how the human machine actually works, you are definitely in the right place. In today's explainer, we're going to break down something that literally millions of people deal with every single day: joint pain. We're going to unpack the mechanics of osteoarthritis and then look right under the hood at how steroid treatments actually provide relief. So get comfortable, grab your notes, and let's start unpacking the science of joint health.
Okay, let's dive into this. To really understand the solution, we've got to perfectly understand the problem first. The medical term is osteoarthritis, or OA for short. Now, you've probably heard older relatives complain about it, but the mechanics behind it are actually kind of fascinating. Think of your body as this highly complex biological machine. Just like the brake pads on a car or, the rubber soles on your absolute favorite pair of sneakers, the moving parts in your body experience a lot of friction. And over time, that friction leads to wear and tear. Osteoarthritis is essentially just the breakdown of joint cartilage. That's the natural, smooth cushions sitting right at the ends of your bones. When those cushions wear away, you're left with pain, stiffness, and a real loss of mobility.
Section 1. The friction problem. What happens inside the joint?
And this brilliantly illustrates the core issue we're dealing with here. First, think about a healthy joint. Notice how incredibly smooth those surfaces are. That intact cartilage is acting as a perfect biological shock absorber. It lets your bones glide past each other totally effortlessly, whether you're running a marathon or honestly just walking across campus to your next class. But then, look at the osteoarthritis joint. With that cartilage lost, the smooth gliding surface is completely gone. So instead of gliding, you get grinding, pure mechanical friction. It's literally bone on bone. And structurally speaking, that is a massive recipe for serious discomfort.
Now, your body doesn't just ignore that grinding friction, it reacts to it. When those bone surfaces rub together, it heavily irritates the surrounding tissues, and your body's natural defense mechanism kicks right in: inflammation. Fun fact for you: when you walk, your knees take a force equivalent to roughly 3 times your body weight. So when those surfaces are bone on bone with all that immense pressure, the joint fills up with excess fluid. It swells up and it gets really hot and angry. This nasty combination of mechanical friction and the resulting biological inflammation is exactly what leads to those super tough, painful flare-ups. And a flare-up isn't just some minor ache, right? It can completely stop a person in their tracks, limiting daily movement and making even the simplest tasks feel totally impossible.
Section 2. How steroid injections work. Targeted relief inside the joint. First up, let's demystify a medical term you're going to see constantly in the literature: intra-articular. In medicine, precision is everything. Intra basically means inside, and articular refers to the joint. So an intra-articular injection isn't like swallowing a pill that circulates through your entire bloodstream and affects your whole body. Nope, it is a highly localized, targeted strike. The medicine is delivered exactly to the site of the problem, right into the specific joint that's suffering from all that friction and inflammation we were just talking about.
So the crucial point is how this actually plays out in 3 distinct steps. Step 1, the medical professional delivers corticosteroids directly to the site using that precise intra-articular method. Step 2, once they're inside, these corticosteroids act as insanely powerful anti-inflammatory agents. If the friction in the joint started a fire, think of the corticosteroids as a heavy-duty chemical fire extinguisher, just instantly neutralizing the flames of inflammation. And finally, step 3, because the inflammation is shut down right at the source, the patient experiences a really rapid reduction in pain and swelling. The fluid buildup decreases, the pressure drops, and movement is quickly restored. It's just a highly efficient biological intervention.
Section 3. Support, not a cure. Setting the right expectations.
Now, what's really interesting here, and absolutely crucial to understand, is the time frame. Corticosteroids provide effective short to medium-term pain relief. They are not some magical, permanent fix. Remember our visual of the worn-away cartilage? Well, the steroid doesn't regrow that cartilage. It's not rebuilding the shock absorber. What it actually does is dramatically lower the pain and swelling for a specific window of time. It acts as a temporary bridge over the problem, giving the joint a much-needed break from that vicious cycle of inflammation.
And why is that temporary bridge so important? Because ultimately, this is a supportive treatment meant to help patients move comfortably enough so they can actually engage in physical therapy. Honestly, this is the real secret to managing osteoarthritis. Think about it. If you're in agonizing pain, you can't move. And if you can't move, your muscles get weaker and the joint actually gets worse. The steroid injection buys you a critical window of pain-free movement. The real long-term goal is to use that exact window to do physical therapy, to build up and strengthen the muscles around the joint so they can take the pressure off that damaged cartilage. The injection is essentially the key that unlocks the door to real sustainable physical rehab.
Section 4. Next steps for patients. taking action for your joint health.
So if you, or maybe someone you know, is struggling with joint pain, the absolute best next step is to consult a medical professional to build a plan that gets you moving comfortably again. But I want to leave you with a thought today. While steroids buy us this really vital window of time, the ultimate question for future scientists, and hey, maybe that's some of you watching right now, is this: how do we find a way to completely regenerate that lost cartilage? Keep asking those big questions, keep studying this incredible machine we call the human body, and I will catch you in the next explainer.